There's growing fears that polio will surge as the world focuses on eradicating the coronavirus. A new Washington Post article dives into this global issue, highlighting new polio infections in countries like Niger and Chad. And this comes as health groups suspend vaccination campaigns amid the coronavirus pandemic. So foreign affairs reporter for the Washington Post, Emily Rauhala, is joining me now. You covered this story, Emily. I think a lot of people may be surprised that there are active polio vaccination campaigns happening in other countries because it's basically been eradicated, in North America. But it still poses a threat in other countries. Can we talk about how the coronavirus threat has sort of trumped the threat of other viruses?
That's exactly right. I mean, polio is a really horrible disease. It targets the spinal cords of babies and children. And we were very close to eradicating it, about 99% of the way. And then along comes the coronavirus, and it's stopping door-to-door vaccination campaigns in many parts of the world.
Emily, I'm so glad that you're able to do this story and to highlight it, because I think a lot of people would be unaware that polio does exist in some parts of the world because most people believe it has been eradicated. When I was based in West Africa, it was a continuous story that we did in Nigeria, although recently Nigeria was able to finally eradicate it in that country. But the problem was that people were resistant in some cases to vaccination campaigns that were happening in parts of the country where they didn't believe in vaccination. And so I'm wondering what you've come across in your reporting, specifically as it relates to the Trump administration and how this pandemic that we're going through right now as a planet, in other words, the coronavirus pandemic, is hindering global vaccination efforts.
That's exactly right. There's a lot of challenges facing polio eradication. There's conflict, there's anti-vaccination campaigns, and now there's the coronavirus stopping these door-to-door campaigns. And then along came sort of another threat, which was President Trump's threat to cut all funding to the WHO. And the WHO is really sort of the leading organization working with partners, including the United States, to get those last countries, those last communities vaccinated against this disease.
So can we talk about sort of the impact of the coronavirus lockdowns? Because I understand that, you talked about the door-to-door campaigns. And so, healthcare providers can't go door-to-door and vaccinate children. But what about the fact that people aren't coming out? What sort of impact has that had?
Coming out of their homes?
Yeah.
Yeah, that's right. If you want to picture what polio work really looks like right now, it's rural areas, people walking door to door, delivering this vaccine to try to get these last kind of outbreak areas under control. So people are staying at home, but the disease can still spread. It spreads through contaminated food, through contaminated water. So if there are outbreaks, the risk of a sort of explosive outbreak in a community is still very much there despite the lockdown.
So, Emily, I recall having a conversation with folks in a village where polio had especially hit hard in northeastern Nigeria, and we were talking about why some Americans refuse to get their children vaccinated. And I'll never forget a mother looking at her child and saying, "Wow, if I had access to what you have access to in America, then my child wouldn't be like this." And so the World Health Organization was trying to eradicate polio in some of these pockets of countries where it still exists. Now with this threatened funding cutoff, what does that mean to its ability? Forget the stuff that perhaps the World Health Organization can be criticized on. There are things that you can criticize the organization from, but cutting the funding, what will that mean for people like those folks in some of the areas that you've been reporting on?
So even those who are very critical of the WHO are, very hesitant to cut this program. There's sort of a broad consensus among scientists, among frontline health workers, among almost everyone really, that this program, needs to continue, or else there are going to be explosive outbreaks in exactly the type of community that you're describing.
So Vlad sort of touched on this, the challenge of misinformation surrounding vaccines. We're actually sort of seeing it now here in the U.S. when it comes to discussions about the COVID-19 vaccine and where's the money coming from and who's behind it and all that sort of stuff. But can you talk about this idea of misinformation and vaccines in other countries where polio was a real threat and how that sort of stymied the efforts?
Yeah, it's a really big issue because the international community is very close to eradicating this disease, but that moment of being very close coincided with a huge uptick in disinformation about what this vaccine does. We interviewed frontline workers who are trying to go door to door to deliver this vaccine and facing strong resistance from parents who believe it's dangerous for their children. And it's the same sort of resistance, interestingly, that health professionals are worried the international community will face when it comes time, hopefully, for a coronavirus vaccine as well.
Emily Rauhala, really, really important reporting. Thank you for sharing it with us. We really appreciate it.
Thank you for having me.